Hello, everyone. I'm Steve Bynum, senior producer of WBEZ's midday show Reset. And welcome to those tuning in on WBEZ's YouTube page and on Reset's Facebook page. And many thanks to Dr. Mia Taormina for spending some extra time with us today so we can get to more of your questions. This week marks a very solemn anniversary, the one-year anniversary of the World Health Organization designating COVID-19 as a pandemic. And at this time last year, the NBA postponed their season, leading other professional sports leagues to do the same. I remember when I was watching the news the night that Tom Hanks and Rita Wilson announced that they had tested positive for the virus. And that was a shifting point for us all. And it made it a bit more real for everyone. And many Chicagoland office workers began working remotely, like all of us right now. And this past year has seen over 29 million confirmed cases in the US with close to 530,000 deaths. In our state alone, in Illinois, we've lost over 20,000 neighbors, family members, treasured friends. But thankfully, light is at the end of the tunnel. And with 3 COVID vaccines now available and mass vaccination sites like the federal site at United Center coming online, we bet you have questions about how to keep yourself and your family safe during this time, the differences between the vaccines, and what you can do after the vaccine. So this 30-minute conversation is designed to provide another chance for you to get verified, timely, and factual answers to all the questions you have and more. And we'll take your questions throughout, so drop them into the comments section at YouTube and Facebook, and we'll get to as many as we can. So just keep sending them our way. And so it's my pleasure to introduce friend of the show, Dr. Mia Taormina. She's an infectious disease expert with DuPage Medical Group, and she answers your questions every Friday on Recess, giving her expert advice with deep knowledge and compassion and empathy. And Dr. Taormina, it's always good to have you here, and thank you for the additional time.
Oh, thank you, Steve. It's always my pleasure. Can't believe we are a year into this. And I look forward to every Friday because I just love to interact with our listeners and to try and provide some of the best available information. I try to stay on top of things as best I can.
Well, you know, you're already doing great service, and so we appreciate the service that you're giving our listeners. Thank you again. Okay, so I want to just start at the top because, you know, I'm going to do a little navel gazing here. My 24-year-old perfectly healthy son yesterday got his first vaccine shot. My wife has her shot. My skeptical mom just got her second shot. I can't get a shot. My 15-year-old daughter who turned 16 in May can't get a shot. There's so many people who can't get a shot. Thousands of doses are being tossed into the garbage, especially in rural areas and unfortunately in a lot of red states. So what gives here? What's the secret sauce, doctor? How do you get a shot when you can't get a shot, when you desperately want a shot?
If you desperately want a shot and you don't otherwise qualify as one of the tiers, tier 1A, tier 1B, or tier 1B plus, say that you're between 16 and 64 and healthy, you don't have a qualified profession or whatnot, there's a little bit of legwork involved, but there have been individuals that have found success going to their local commercial pharmacies at the end of the day and asking, is there an extra shot? I'm happy.
I had heard that, doctor. So I wasn't clear on that because it sounded a little too simple. So you just, if Walgreens or CVS closes at 8 p.m., show up at 7:30 and say, do you have any extra doses?
They generally stop giving vaccines around 4:30, 5 o'clock. So you can ask casually your pharmacist, hey, what time are your last vaccine doses each day? And if they say 4:30, 5 o'clock, that might be your opportunity to do a little shopping at CVS or Walgreens or Jewel Osco and swing on by and say, hey,
swing on by it. All right, very
also
good.
Encourage, we've got so many seniors that are still trying to get access to vaccines. We've had otherwise healthy adults have some incidental luck by doing that good Samaritan deed of getting a senior to their appointment, only to find out there are extra doses that day. So that is your best bet if you don't otherwise qualify. In fact, that's sort of the only way. I wouldn't encourage anyone to lie or fabricate or otherwise try to jump the line. But a vaccine in the arm, regardless of your comorbidities, if you happen to be fortunate enough to get one, is moves us towards this herd immunity that we need to get over this thing. So the rest of everybody, your vaccine is coming soon, so soon. We're looking at about 6 to 8 weeks before there's really widespread accessibility to vaccine for all.
Okay, Doc, take your word for it. So actually, you had mentioned comorbidities, and it dovetails perfectly into a question from Greg on YouTube, who asks, and I believe you may have touched on this on the show, is asthma included in the next tier for vaccination? And actually, we know that people who are currently undergoing cancer treatments, they qualify. But what if you are a cancer survivor, you're cancer free, but you're not, or you're not under treatment?
Sure. On a case-by-case basis, most cancer survivors will qualify for vaccine under Tier 1B. A lot of cancer survivors have had pretty toxic chemotherapy treatments and radiation that could otherwise cause some lasting effects to their lungs, heart, other organs. So even though they're fully recovered and God willing, living their best life cancer-free right now, they may have absolute criteria to get vaccinated as a higher risk group. Also, asthma is another thing. If there's some mild exercise-induced asthma in somebody who uses a rescue inhaler a couple times a month, it's less likely to be someone who needs to be at the front of the line versus someone with severe asthma and underlying pulmonary conditions that a doctor can absolutely write a justification letter for those individuals to get vaccinated as soon as possible.
Now, is there any kind of documentation if you try to sign up as having one of these comorbidities? What's that process? Because it's not simple, right? You sign in and then they'll say, well, do you have this? And then you click, and then even still, it's a little dicey.
There's been situations where individuals are not asked for anything at all. They show up with their insurance card and their ID and they get their shot and leave. And there's been instances where absolute documentation is required. And generally, a letter from your doctor is sufficient. You may also have access to your MyChart where you can show a list of your diagnoses and or medications. If this is a pharmacy that you frequent for your prescriptions, they should have a list of your prescription drugs, and any pharmacist can be able to tell exactly what those medications are used for. So usually it's okay. Not too many people are getting turned away unless there's some really strict issues going on, and hopefully be prepared with a letter from your provider if you can.
Okay, very good. And so we have a question from Bonnie, who's watching us on Facebook. And Bonnie says, my 70-year-old husband got his first Pfizer dose at a Cook County site, and they gave him the second appointment for 17 days after the first dose. Is this okay, and how will it impact his final immunity?
So in all probability, it's okay. It's not preferred. The preferred interval for Pfizer is 21 days. There is some latitude, and that latitude does extend to preferably no more than 3 days ahead of time and all the way until 6 weeks afterward. I always say that if your choice is between too soon or a little bit late, I would much prefer a little bit late.
Sure.
But in all probability, when these vaccines are given in too soon of an interval, you should still be able to mount very adequate spike antibodies to the vaccines. If there's any convenient opportunity to change that to 21 days or later, please do so. But if it risks missing the dose altogether, absolutely get it when you can.
So given those recommendations, doctor, how do you account for instances where people are scheduled that far ahead of the recommended time window?
I mean, for lack of a better way of putting it, they shouldn't be. There should not be, except for extenuating circumstances, which sometimes happens with a mass vaccination clinic at the site of a nursing facility or something like that, where it just happens to be that day and only that day. Otherwise, if there is scheduling flexibility, scheduling should not be done before day 21. And many commercial sites like Walgreens for sure has moved towards a 28-day schedule for either Pfizer or Moderna. And that's perfectly okay to have your second Pfizer dose at day 28 instead of day 21. Those who have gotten it on day 17, 18, 19, 20, again, are probably okay. No additional doses are needed. But if you haven't gotten your dose yet and there's an opportunity to move it later, that would be the recommendation.
Very good. You mentioned nursing homes, and this week the Biden administration also relaxed restrictions on indoor nursing home visits. Can you tell us more about that and what that means for indoor nursing home visits in Illinois?
We're getting there, and so many folks have not been able to visit their loved ones in nursing homes. We've seen these incredible declines in depression and functionality of our loved ones who have just not been able to socially interact with individuals beyond the care staff at their homes. It's time to hopefully get more of these visits. Fortunately, by prioritizing our nursing home patients, a significant percentage of nursing home individuals are fully vaccinated at this point. And we now have reached a point where interacting with another healthy adult who may or may not have had their vaccine yet, even one-on-one without a mask, it's becoming reasonable. Yes, entering into nursing facilities, you're going to be asked to wear a mask, but if you have the opportunity to get outside, maybe have lunch with one of your loved ones, I think that taking that mask off for that encounter, we're moving towards that. So I look forward to being able to slowly reopen these doors, and hopefully with vaccinated adults meeting with vaccinated patients. But even in the cases of unvaccinated healthy adults, we're starting to have those hugs again.
Yeah, you made me think of something, Dr. Taormina, in that because the workers in nursing homes are essential frontline workers, they were vaccinated and the patients were already vaccinated. If the visitors bring proof of vaccination, a lot of people have been asking about the caution, or what they consider over caution, in that if everyone's vaccinated, what are, as far as you can tell, especially from not mixed messages, but sometimes unclear messaging from the CDC about why is it that we can't all just do group hugs and all if everyone is vaccinated?
We're close. I think that the updates that we got this week are absolutely leading in that direction. Already we're to a point where a small group of office workers can absolutely take their masks off and have lunch together if everyone is fully vaccinated. We are getting there. I think the issue becomes so many different folks from different backgrounds, and we still don't have 100% assurance by any stretch that you cannot transmit some of these viruses, and especially these variants, to those that are medically vulnerable. At the end of the day, we're not checking antibodies on everybody, and 5% are not going to develop antibodies. And it's really difficult to tell who that 5% is. But statistically, 95% of people will. And even if you have not as robust of an immune response, you should still have protection in some ways to have a much less devastating disease or illness that occurs. So I think that we are slowly moving towards that statement where eventually we won't have to have these masks on in settings like this. It'll be a while for everywhere because we will need herd immunity in the entire public. But in the microcosm of a nursing facility with everyone vaccinated, we're approaching a herd immunity in that environment, and we may be able to get to that point very soon.
What's that number? What's that percentage?
Yeah, 70, 75, 80. I want to see that number being pretty high. I would say that 70 is about the lowest end for me. We know it has to be the majority. Some people have put out numbers a little bit less than that, but I'd like to see 70, 75, 80% of all Americans vaccinated between the ages of 18 and 150. And then we have achieved the goal of herd immunity.
What does it mean if we can't get there because of skepticism, because of systemic problems, even though we are ramping up and improving? What does that mean about protocols and our behaviors going forward?
The future is in our hands, and there are certainly individuals who have true, legitimate medical reasons for not getting vaccinated, and that's why all of us get vaccinated to protect them. Folks that remain skeptical, as time moves on, the reassurance is being had. We're not first in line anymore if we haven't been vaccinated. There are tens of millions of people in this country who have gone before us, and we are seeing no significant untoward effects. We know that 15% of people that get COVID, regardless of their medical comorbidities, are having severe outcomes and potentially long-lasting side effects from coronavirus infection. It's becoming a decision that's really pushing the needle towards getting that vaccine. And we're also starting to see this hopeful information from the CDC, where it's not necessarily an immunity pass, but this could make big strides for you being able to safely interact with vulnerable individuals, for you to be able to travel and things like that moving forward. The vaccine is the means to the end of this pandemic.
We are midway through our time at the Reset After Show with Dr. Mia Taormina. She's an infectious disease expert at DuPage Medical Group, and she's answering your continuing questions after our Friday Reset segment. And I'm very happy that Katie has decided to check in with us on YouTube with a very interesting question. She says, I know the virus may be transmitted through the eyes, but don't hear much guidance for eye protection. Do new variants make this more of a concern? And what are the best tips to mitigate? For instance, are glasses or contacts better? I'm going
That's a
to take
very
off
good
my glasses for
question. That's a very good question. In terms of eye protection, glasses and contact lenses are not considered adequate. So you would need to have something that covers a little bit more surface area and preferentially the sides of the eyes as well. So more of a goggle or more of a face shield, something that comes down. As we approach these variants and as we have these discussions about do we need more social distancing? Do we need double masking? Things like that. Eye protection was kind of visited and then not visited in terms of something as an additional mitigation strategy. Very minimal. You'd have to be in really close contact with somebody to risk an exposure to a variant or to coronavirus. You would need droplets in your eyes or to self-infect, meaning that you've touched somebody or shaken someone's hand and then touch your own face and touch your own eyes. That's going to be the bigger issue here. I would think as it comes time to be concerned about potential variants. If you are unvaccinated, there is data behind wearing more than one mask. That would be a surgical mask with a cloth mask over it, or a single KN95 or N95 mask, especially if you're vulnerable. That would be the mitigation step that I would recommend, aside from widespread use of goggles or face shields, unless you are in a work environment or a personal environment where you have to interact very closely with individuals and you cannot maintain 6 feet of distance indoors.
And we have Nomar who's watching us on Facebook. In his question, he says, after getting 2 shots from Pfizer and Moderna, or the single shot from Johnson & Johnson, how many months are we protected before we need to get the next booster shot? I'm worried that there will be a gap where I may get infected and really get sick. And this really is a good point, because now it's coming out that you get the 2 shots, you still may have to get another booster down the road. So we can maybe talk a little bit about those boosters and directly to get to on Nomar's question.
Sure. What we do know is that the original study group of tens of thousands of participants in the Pfizer and Moderna studies, they're 60 days ahead of us frontline workers who got our vaccines back in December. So they still have very good antibodies, very high levels. When the CDC comes out with recommendations saying that you should be protected for at least 90 days, all signs are pointing towards that being pushed out even longer. And in fact, this latest recommendation of being fully vaccinated plus 2 weeks, it doesn't say you can hang out with your family members for the next 90 days. It doesn't give a finish line there. Do I think that there will be boosters? Yes. Most scientists are predicting 6 to 12 months. It'll probably just be a single shot, and likely a shot that's designed to cover some of the circulating variants. Do I think this is going to be an every year thing? I don't know yet. I think it's too soon to tell. I think that it's highly likely that we are going to all need some kind of booster dosing in the next 12 months, in the next year. But beyond that, as a seasonal vaccine, I think it's a little bit too soon to tell. The seasonality of COVID and of these coronaviruses does not necessarily mirror the seasonality of influenza viruses. So time will tell on that one.
So if it turns out that this does become an annual thing, do you think it'll be a combination flu with COVID, or will it have to be 2 separate shots, one for flu, one?
I would love a polyvalent vaccine, and I think messenger RNA technology and even the Johnson & Johnson modified adenovirus vector technology, this is revolutionizing vaccines. But where we were, a little bit nervous about this new technology, we are seeing where this is becoming the gold standard, and the ability to use messenger RNA technology in viral vaccines to prevent things like coronavirus and eventually influenza, respiratory syncytial virus, and other viruses. Polyvalent vaccine that covers multiple strains of multiple viruses is certainly a possibility. We have these with pneumococcal vaccines covering 13 to 23 different variants of pneumococcus. So it's definitely a possibility that we could have a combination shot like this. I don't know how soon, but I think that the blueprint is there in order to move this technology forward and continue to use it to our advantage. It's pretty impressive.
Thank you, Doctor. Ken has a question. He says, my son has Down syndrome and JRA. His doctor has said that they are not sure the Pfizer or Moderna vaccines are safe. He takes Enbrel and Melexicam. Can he more safely take Johnson & Johnson? He can't go back to his bagging job in a food store until he has some type of vaccine.
Sure. I don't see any reservation with giving any of the available vaccines to an individual like that. The risk of getting coronavirus is far more likely to cause an adverse outcome in someone with those comorbidities versus the vaccine. Being that he's on Enbrel, and being that he has a juvenile rheumatoid arthritis, there is that possibility that he won't mount as robust of an immune response. So I think it's all the more important to get those doses in him to see if and when he might need a vaccine booster moving forward. If your child is under the age of 18, the only option is Pfizer between 16 and 18, and until we have more data on the 12 to 16-year-olds. But otherwise, I would say that he is safe to receive any of the vaccines, and similar adults that have similar comorbidities, we've absolutely vaccinated successfully.
And Matthew has a question on YouTube. There seems to be a discrepancy between when Chicago says 1C will start and when Illinois says it will start. Do you have a more confident date to offer?
I have a confident prediction that Chicago and the rest of Illinois will be different dates. I think they're going to be two separate dates. Currently, the targeted date for the city of Chicago is March 29th, March 29th. I don't know that that will be the date for the rest of the state. I think that we have a concentrated population in Chicago, and that group of individuals living in close proximity to one another is being prioritized in some way, and able to get into some of the depths of the communities that are more underserved in the Chicago area is important. I don't think that it's going to be weeks and weeks and weeks different, but it's very possible that we might not get to 1C in the collar counties and the rest of the suburbs until well into April, possibly as late as that May 1st date. But I'm hoping that 1C will come still at least a couple of weeks before the so-called free-for-all open the doors on May 1st. But we'll see. Time will tell. I don't think everyone's going to move to 1C on the 29th, though.
Great. Thank you, Doctor. Julia on YouTube has a question. Is there any data on increased behavioral health issues such as anxiety, obsession, obsessive compulsive disorder, and post-traumatic stress disorder?
With coronavirus, with quarantine?
Well, she doesn't say, so let's just take them both, with coronavirus and with the vaccine.
I think that I've seen a lot of people that have been wholly traumatized by having an experience with coronavirus and being hospitalized because of it, feeling their own, for lack of a better way of putting it, mortality, because for many people, this is the sickest they've ever been in their lives, even if they've fully recovered. I have colleagues that, I have a friend of mine from medical school who spent time on a ventilator. I mean, this is some scary stuff, and certainly the aftermath of it is going to have anxiety and post-traumatic stress from an experience like that. I think anxiety, depression, post-traumatic stress from quarantine and lockdown and not being able to interact with our peers, our colleagues, our coworkers, our schoolmates has had a devastating impact. This is why we do have to prioritize getting back to as close to a normal state as we can. And I think our children are among the most vulnerable, who aren't necessarily able to verbalize some of the things that they're feeling and experiencing with all of this. Our youngest don't necessarily even know any different. This is their reality. So I look forward to, focusing on the mental health aspects of this aftermath of this virus, whether it's the aftermath of the clinical illness or the aftermath of just being locked down for this past year. And similarly, our adults, our seniors are not okay. We have many seniors that have been locked down this entire time, homebound and fearful. And they are more prone to loneliness and depression and being away from their family members. So again, the time has come. We need to prioritize getting everyone vaccinated and getting these kids back in school and focusing on mental health impacts as well.
So a quick follow-up before our last couple of questions. As far as you know, have there been any psychological reactions from the vaccine, or any drug interaction with antidepressants or any type of psychotropic drugs?
At this point, I am not aware of any. There is been a number of individuals who get vaccinated and may have a near syncopal event. They may pass out or almost pass out. There's a lot of angst going into the energy of getting vaccinated, a lot of apprehension and a lot of hope and a lot of fear and all sorts of those emotions mixed together. So have we had individuals that feel a little dizzy afterwards, or, for all of that release of adrenaline? Yes. So that does occur, very short-lived generally, and patients usually do really well and have minimal side effects on the whole. I am not aware of anyone receiving vaccine and having a psychotic break or anything along those lines. So all in all, seems to be pretty darn good. No interactions with medications that I've seen at all.
And we have a viewer on YouTube who asks, who says, my husband has a heparin allergic reaction. I also have a latex allergy and had an MRI contrast allergic reaction. Should we get vaccinated, and would there be any difference in the vaccines regarding allergic reaction?
For the most part, folks that have allergic reactions to other medications should definitely speak to their doctors about the risks and benefits of getting vaccine. Again, we have had individuals with all of those above allergies receive vaccine without any issue. If you do carry an EpiPen for any reason, you should have your EpiPen with you when you receive your vaccine out of an abundance of caution, and be prepared to stay at least 30 minutes, not just 10 or 15 after your vaccine, to observe for any immediate adverse reaction. The elements that are in those medications listed, and contrast dyes and things like that, are not at all in any of the available vaccines. So the chances of having a reaction because of a history of reactions to those other agents would be very, very slim. But people that do have anaphylactic reactions or severe adverse reactions are those that tend to have allergies to other things in general. So if you have an allergist or immunologist, please speak with them. Otherwise, have your EpiPen ready. But I do not see a contraindication to any of the vaccines, and you definitely should be vaccinated.
So I wanted to spend the rest of our time summarizing a number of questions that we received about, the biggest thing that we're all thinking about, and that's getting outdoors and being able to do so more person to person and enjoy activities in group settings. And so we have a question that says, this week, Mayor Lightfoot announced fans will be allowed back at Chicago ballparks at 20% capacity starting on opening day next month. Is it the right time to start loosening guidelines on sporting events and summer activities? Will these kinds of gatherings be okay because they're outdoors? And then to follow up, what's the latest on outdoor spread? And can people start to feel safer outdoors without masks once they're vaccinated?
Sure. I mean, this does come down to what President Biden said, too, about having that 4th of July picnic. Can we have a 4th of July picnic with, multiple family members? The old 4th of July picnics might have had 20 or 30 family members outside at the barbecue. And I think that that is a reasonable thing that we are moving towards. And I think by July, we are definitely going to be there. Do I think we're ready for Lollapalooza? No, not quite yet. I think that we need to achieve a greater amount of herd immunity before we have that many people interacting together. I think opening up places like Wrigley Field to 8,000 spectators is amazing. For the most part, we're going to have young, healthy folks going to ball games. Should you have significant immunocompromised issues and other things where you have not been fully vaccinated, I might take a pause on that. But if you're healthy and unvaccinated, or fully vaccinated otherwise, I think that going to an outdoor sport, an outdoor concert, and interacting with slightly bigger crowds is going to be something that we can move towards later on this summer. Vaccines are key. That's my preference, to get everyone fully vaccinated in 2 weeks past their dose of vaccine that completes their series. But otherwise, unvaccinated and otherwise healthy, or kids that are not yet eligible, should be able to begin to interact in bigger groups unmasked.
And finally, to what degree do you believe that what we don't know about the ability of vaccinated people to spread the virus may be what's in play as far as being cautious about these larger gatherings?
It absolutely is. And that's what happens as more time passes and more reassurance is had regarding the fact that we are seeing the chances of being a transmitter of this virus after you are fully vaccinated being very, very slim, especially if you are asymptomatic and have no symptoms at all. We are just simply not seeing individuals who are fully vaccinated spreading this virus in any meaningful way. And that includes those who are fully vaccinated are in a household with someone who has COVID, possibly even their bed partner. And we're not quarantining those individuals. We're not testing those individuals unless symptoms arise, because the chances are so slim. So while we can't say definitively that it is impossible, nothing is ever impossible, that transmission can't happen, we are seeing the probability of having a vaccinated individual being a meaningful spreader of this virus as being very, very slim. And that's encouraging. And as that data rolls in, that's what's leading toward more and more of these statements from the CDC that we can start to feel somewhat normal again when interacting with our friends and loved ones.
Well, that'll have to be our last question. I mean, the time really flies with you. I mean, you were born to do this, Dr. T. Dr.
Well,
Terry, thank
it's
you
been my
so
pleasure.
much for giving us the extra time into answering these questions today.
Thanks, Steve.
And thanks to all of you who are viewing on our WBEZ YouTube page and on WBEZ's Reset Facebook page. And please do follow us and continue to look for updates, because this is a very fun and informative segment, and we want to do more things like this in the future. And also be sure to tune in to Reset on Monday starting at 11 a.m. And for those of you, we just talked about getting outdoors, who are itching to get out like I am, like I'm sure Dr. Taormina is, like my daughter upstairs who can't wait to get out. Make sure you check out WBEZ's 91.5K. That's a month-long virtual race in the month of May, and that's designed to help folks get active and learn more about the communities that make up our great region. And you can find out more information on that virtual event at wbez.org/events. I'm Steve Bynum, and for Dr. Taormina, we both hope that you have a great weekend and that you all